As a result of the coronavirus, COVID-19 pandemic, one leading Florida mental health care provider has created the first ever drive-in teleclinic. Here's my story. One of Florida's leading mental health care providers, Health Psychiatry, announced the expansion of their Florida-based practice to include drive-in telepsychiatry at their Tampa Bay headquarters in Oldsmar. In the wake of the coronavirus and the contagion fears that many doctors and patients now have with this virus, proper patient screening is vital in setting up the correct and safe protocol and providing accessible mental health care during this crisis, especially now when anxiety, depression, and panic are at heightened levels. Chief Medical Officer Dr. Dinar Sejan feels this added service fills another crucial need to provide patients quality mental health care during these uncertain times.
My number one patient population that I am working on the psych clinic, the drive-in clinic, are the older population who are extremely high risk. This will help them still connect with us. This will help them still be able to take care of their mental illnesses, their emotional issues, and yet be super safe, as in this model there's no human touch.
Health Psychiatry founder and CEO Usman Izad, an innovator in telepsychiatry, saw a need in the marketplace when he realized that under the current COVID-19 conditions and social distancing that there was a need for patients who may have cold or fever symptoms and who do not have a technical savvy to access the telepsychiatry system that Health Psychiatry provides from home, or for the patients who are simply anxious and don't want an in-person appointment with one of their providers.
Every clinic is screening a patient nowadays. And if they have flu, fever, symptoms, they said, no, you go to hospital. Hospital is already getting jammed.
I have seen my patients decompensate tremendously in the past few weeks.
So I thought that where these patients will go, and especially in these days when they have symptoms, right, they have more panic, their anxiety level go up, right, they're feeling depressed.
People with hardly any significant psychiatric illness, they are coming now as new patients with tons of anxiety, panic attacks, depression, inability to sleep, unable to eat, unable to just get through the day.
So as being the CEO of Health Psychiatry, it's my moral and ethical duty to come up with a plan, especially in this time of need, to help out my patients in each and every way.
Okay, here's how it works. When a patient calls in, intake staff determines who can best derive benefit from the drive-in teleclinic, and they set up an appointment with the patient. Arriving at their scheduled drive-in teleclinic appointment, patients pull in and power down their car window and connect through Health Psychiatry's pending patent telepsychiatry system. A member of Dr. Sejan's psychiatry team then conducts the session virtually, just like a regular appointment.
Any person who is having any kind of symptoms, even if it's an allergic cough, if it's just a viral fever, nothing to do with the coronavirus, we offer them the option of drive-in telepsychiatry.
I made some systems back in 2013 and 14. People were making fun out of me at that time. Usman, what are you talking about? This is not possible. Now the whole world is doing tally, right? We are way ahead of game because we already started doing telepsychiatry maybe like almost about 1.5 years ago.
Now, should the condition warrant, a medical prescription can be electronically dispatched to a convenient pharmacy. All insurance and payments are handled over the phone to eliminate exposure, so there is no physical human interaction. Therefore, the new drive-in teleclinic allows patients to receive quality, crucial mental health care from the comfort and protection of their own car.
We have exactly the same protocols, the same systems in place. We have been doing telepsychiatry in remote locations for a while now. All of my providers, of course myself included, we are very comfortable doing televisits.
The team at Health Psychiatry are so excited to begin delivering the same quality mental health care services to socially restricted patients during the coronavirus outbreak via their drive-in teleclinic. That's their mission, to deliver compassionate mental health care.
If I can save one life in this coronavirus situation, I will be so proud of putting this together.
It makes me very proud to say that at this time of global crisis, I'm still able to provide services and I'm still able to provide care.
All right, that's a wrap from Health and Psychiatry from the first ever drive-in teleclinic. For Good Life Tampa Bay, I'm H. John Mejia. For more information, please check out their website at healthandpsychiatry.com. That's healthandpsychiatry.com. Or call them at their corporate headquarters at 727-733-6111. That's 727-733-6111.